On the day of my procedure, should I take my daily medications?
On the day of your procedure, you should take your daily medications. I'll put an asterisk by that and I'll come back to it. Our procedure is a minimally invasive procedure through a small hole. It's not an open surgery, so you're not getting general anesthesia. You're not gonna have a tube, a breathing tube down your throat. You're just gonna get an IV with the medication. So while you have to be NPO, meaning the night before, don't eat or drink anything after midnight. So the morning of, the day of the procedure, don't eat or drink anything. However, if you need to take a small sip of water to take your daily medications, that's okay. Right? One of the biggest reasons that patients going for a medical procedure or surgery the next day have to be NPO after the night before, meaning no food or drink, is because if they undergo general anesthesia, which we don't do, but open surgery does, there's a risk of aspiration, meaning some of that food or drink in the stomach could come up and go into the lungs, and it's irritating to the lungs. So the aspiration risk for us is lower because we don't use general anesthesia, we use conscious sedation. It's perfectly fine to take a small sip of water to take your daily medications. Now let me come back to the asterisks. There are some medications, especially for people with renal impairment, impaired kidney function, that we do ask that you hold for a few days to let the kidneys sort of clear out. Metformin is one of those. But again, I don't want to get into the details because it may not be relevant to many of you. When you come to us for evaluation, the first time you visit us, it won't be for a procedure. If you have a wound on your legs that's not healing, or if you have leg pain, give us a call, have your physician refer you to us. We're going to see you for evaluation on our first visit. We're going to do a history and physical, we're going to check your pulses, we're going to do ABI, we're going to do arterial ultrasound. Nothing's invasive, it's not going to hurt. And we're going to see if you have peripheral arterial disease. And if you do, then we'll talk to you about getting the procedure done, hopefully with us, on a subsequent date. At that point, we'll also look at the medications that you're taking. And if there's any that need to be stopped a day or two prior to the procedure, for example, metformin, we will let you know. But other than that, the big picture answer to the big picture question, can you take your daily medications the day of the procedure with us? You can with a small sip of water.